Okay. So most of you guys are about 8, right?
No.
8 or 9? Wow, that's pretty good. Okay, let me do yourself, guys. Well, from 8 or 9, your teeth are about the same. Does anybody have any idea how many teeth they have when they're little? We'll ask you with the glasses. How many teeth? What do you think? You don't know? Tyler, what do you think?
I forgot.
Okay. Pumpkin? 10. Well, that's pretty close. You have 10 on the top and 10 on the bottom, so you have 20 teeth. And when you're little, and when you get older, you have 32. That's pretty cool, huh? Well, this is an extra bag? Oh, this is your bag?
No, this is...
Oh. Okay, I'll put it over here. We have an extra one, all right. Anyway, your teeth are kind of divided into front teeth and back teeth, guys. Anybody have you look at your picture? The teeth are called, the front teeth are called anterior teeth, and they're kind of like incisors and canines. That's kind of the way God set it up. And the back teeth are usually premolars and molars. And they're these more square guys here. And if you guys read out here, can anybody read what this says here? Dr. Jeremy's daughter. I forgot your name. Corinne. Read that to me and tell me what it says. Your dad should know these things too.
My back teeth are for visors.
Sure, go ahead, read them.
My bottom teeth are for munching. My front teeth are for tearing. My back teeth are for pinching.
Well, that's kind of a neat poem. But that's what the teeth do, just in general. And here's a diagram of how the teeth kind of look. If you saw them divided, kind of like how the body picture is divided there, like if you had invisible vision, you can see through stuff, like X-ray vision. The outer part of the tooth is called, does anybody know? Enamel, right. What color is that?
White.
Usually white, yeah. And then the next part inside is called the what? The crown is the part that you see inside the mouth. That's this part. Yes, son? Dentin, very good. And dentin is made of millions and millions of little tubes, and that's sometimes why if you get like a toothache or you have like a hole in your tooth or a cavity, it hurts more. That's the dentin conducting the pain into the nerve of the tooth. So, and inside there is called the what? What's inside there? Inside the dentin, Josh.
Inside the dentin would be, oh yeah.
Starts with a P.
Pulp?
Pulp, right. Very good. And inside the pulp is made of nerves and blood vessels. So a tooth is alive. You guys all knew that, right?
Yeah.
It's a very alive thing. So, and there's, what do you think holds the teeth in, guys? Son? What's that? The root, right. The root holds it into the bone. And the area in the mouth where the bone is called the alveolar crest. Those are the ridges. That's how it kind of connects in. It's surrounded by lots of little ligaments. You really can't see them, but you guys can color these in if you want to. In fact, if you come to the office, you bring your gift certificate in to get your cleaning done, you need to color your tooth. Okay? So we're going to go white, kind of like beige in here, red in here, and you guys can kind of like do beige or be creative with the bone, however you want to do it. That'll work. Is that fair, you think, Mr. McNevin? You should definitely have your tooth colored in. How many times a day do you guys brush your teeth?
If you can, try to do it after you eat or before you eat.
Okay, probably after is even better. That's very good, listen. Can anybody tell me why? Son?
Because, there's plaque on it.
Yeah, well, yeah, plaque forms from a bunch of different things, but you gotta get the food and the sugar off your teeth. Go ahead.
And it becomes decay on your teeth.
Yeah, with time, because the bacteria that are always in your mouth all the time, they use the sugar that we eat and the food that we eat, and they turn it into acid. And the acid kind of sticks to your tooth, and after time, your teeth become sensitive. Anybody here had a cavity with a filling yet? Put your hand down, Josh. You're not supposed to do that. The dentist is done. You have to? Okay, so it's normal. It doesn't really hurt that bad. Then they got to go in and clean it out. You had 2 cavities? That's okay. Front ones, huh? Okay, that was probably like my baby bowel. Do you guys know what fluoride does? Let's go ahead again. Tell me.
It cleans your teeth better?
Yeah, it kind of does. It really helps. It helps a little bit. It makes the enamel a little bit harder so that the bacteria can't get in quite as easy. You know, it's like putting like bars on your windows. So, sort of. Anyway, what do you think are good foods, guys? What do you think are good foods to eat? Allison?
Like crunchy vegetables.
Crunchy vegetables are good. They really are. Yeah, they are. The other kind of foods?
Fruit.
Fruit is really good, yeah. I like fruit is nice, but dried fruit's not so good, like raisins, guys, because it sticks to your teeth. Anything that sticks in those grooves that God saw fit to make in your teeth, that causes decay because the sugar sits in there. Josh?
Steak or other meat.
Yeah, I think that meat's a good thing. Fish. But you guys learned about a balanced diet. You guys were learning that in your nutrition class, weren't you? If you guys follow the principles that were outlined in that nutrition class, in your book, most of that will really help. You guys need a certain amount of calcium, especially you guys, you're still growing so much. You guys use up all these nutrients that you put into your body, and that's why it's so important to make sure you have a good diet. Otherwise, you'll always be kind of little, and it's better to grow and have strong bones and teeth and eyes. Son?
Vitamin A.
Sure, vitamin A is good. Vitamins are good in general. Yes, Emily?
Apples.
Apples are great. They kind of fall into the crunchy vegetable, crunchy fruit diet. What did you guys have for lunch today? Anybody have anything?
I had a banana.
You had a banana? Bananas are good. How about you, son? Apples are good. You already forgot. I don't know. Carrots are good. Josh had carrots in his lunch, I know that. Tyler, what'd you have?
I had a sandwich.
A sandwich. What kind?
Bologna.
Okay.
I like bologna.
Box, son. Jeremiah, what?
I had ham and bread and cucumber.
Cucumbers are good.
I like
So what did you have?
I had a peanut butter and jelly sandwich with whole grain bread.
Okay, well that's good. And you two guys, what did you guys have?
I had an apple.
Good. Apples are good. So, you know what? Sometimes a thing like an apple or a carrot, or I like pears, are one of my favorite things. If you can't get to a toothbrush, those actually help a little bit, don't they? Because they kind of crunch and they remove some of the plaque a little bit if you're kind of between meals. So you guys are kind of young to floss, but we get you those little dinosaur floss things that go in there because they're easy for little fingers to use. And you guys should be able to use them more than once if you wash them off like a toothbrush. Yes? What?
I floss before I brush my teeth.
I do too. That's the best way to do it. When you guys are going to floss, you should always floss first because it pulls the yucky stuff out from between your teeth. Yeah, well, that's sponsored by, who is that?
Crest.
That's Crest. Okay, well, big industry. Forget them. First we floss, then we brush. It's just better that way, okay, guys? And does anybody have any idea when the most important time of the day to brush is? Josh?
In the morning.
Okay. Next. Princess, when's the best time? If you only could do it one time, when do you think the best time to do it would be?
At night.
At night. She's telling me secrets. Yeah, at night before you go to bed. Because you're going to lay there for 8 or 9, maybe 10 hours in you guys' case, and all that stuff that you ate, right? And it's all stuck on your teeth. And there you are sleeping. Oh boy, so at nighttime when your mom and dad tell you it's time to go to bed, you really got to make sure you get in there and clean them good. All right? I got a lot of smiles here. I don't know. I think we have a lot of guys that have toothpaste on their finger and rub their teeth. What do you guys think the next best time is? Josh?
Probably once you get out of school.
Okay. I was thinking morning. Your first one. Is it Princess?
In the evening?
Evening is okay. Probably the morning and the nighttime are the most two, number one, practical times, and also the best times to do it. Most of you guys don't carry a toothbrush in your lunchbox, do you? When I was in school, I had a friend named Brian. I was in about 3rd grade in Detroit, and he used to actually carry a toothbrush. And he would brush his teeth after lunch. It was amazing. So he was the only kid that carried a toothbrush. And you know what's funny is we all made fun of him. So, but you know what? It's probably really the right thing to do, isn't it? When you think about it. So, and anyway, that was that. You probably never had a cavity. Do you guys know how to brush your teeth the right way?
Yeah.
What do you think we do? How do we do it?
Little tiny circles.
Right. That's pretty good. Now, I'm going to show you guys a second. Jeremiah, what do you think?
The chewing part, the outside and
Yeah, you've got quite a few areas on your teeth. When you look at them, you've got, I'm going to pass you guys out the model teeth, and you guys can kind of circulate them around. Princess, you want to take a look first? There you go. Well, the teeth go all the way around, and I have an extra set of teeth here, like so. And I have brought the toothbrush, too. Whoa, that's big, isn't it? We have a big dog. We could probably brush his teeth with that. Okay. You were the one who told me little tiny circles, right?
No.
Who was that? Ah, little tiny circles. Kind of like that. Probably would be better to kind of make a little bit bigger circles and get the sides, but first we floss, and then we're going to kind of come through here, and we're going to scrub the tops and scrub the sides, and always, or most people forget to scrub the inside down by their tongue. I know when I'm in a hurry, that's the spot I miss, and usually about the time I get to work, I can feel it. I'm a dentist. Uh-oh. So, you guys brush. I want you guys to brush in small little circular patterns like that, okay? And get those front ones. Probably you should do the front ones last, because that way I know you'll spend the most time doing the front ones, so take care of the back ones first. And the front ones are the easiest to get, so we'll get those very, very last, because they're the easiest and the most fun to do, right? And those are the ones that Mom and Dad check before you go to bed, too. So, well, let's go ahead and we'll do a real good job of brushing our top ones in the back and on the inside, like so. And then the bottom ones, and the back side of the bottom front ones. You know, here when you guys do the bottom front ones, you got to get in there like that. So you guys want to, I'm going to start going this way with this one. Let these guys all show me how they brush. The right way, okay? Allison, go. Got a picture of Ronald Reagan in your book. Outstanding. Where is he now?
dead.
He was outstanding. Go. Very good. That's a little bit aggressive. Try to go on the inside. Show me how you're going to do those. I got to open them up. Okay. Brush them on here. This is the most important part. Everybody knows it. That's when you miss the most. All right. Pass that on to Luke. Luke, go. You're up, son. That's not actually been the dog's mouth. It's just a plain toothbrush we keep on the shelf. Luke, man, you're stalling the teeth. I need circles. I need circles. All right, there you go. Luke. Good. How do you say it? Alice. Okay, see, I thought it was Elise. That's a nice name, Alice. Elise? That's a nice, pretty name. I figured it was, yeah. I have a friend whose name is Alice. Good going, Luke. Pass that one on to that nice little girl behind you over there. Amber. I don't know everybody's name, but we'll get there. You guys have any questions?
No. I do.
You guys can do that?
Tyler.
Very good. Tyler, what's your question?
They're going to be breaking glasses like they yeah.
Tyler, what's your question? Oh, I thought you did.
They're just putting a toothbrush up.
Oh, was he? Okay, good. 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 Good, guys. Thank you, man.
Jeremiah. I have an
Oh,
orange
the brush
toothbrush.
This is pretty well covered, I think.
Sure.
I didn't have a dinosaur.
Maybe check with Mrs. McNevin, honey.
What's up?
Check with Mrs. McNevin if there's something else you...
Is there anything else you want me to cover with these guys? That's really about the size of it. We eat right and eat the right kind of foods, and we know what the bacteria do. I mean, it's like they go to two broad I haven't done one of these in a couple of years.
I like the brushing, that was good.
No.
Yeah, did you cover cavities?
Did I cover cavities?
Yeah, did you tell them how